Now, since Donald Trump has taken over as the 47th US president, his disruptive decisions has taken over the headlines of the whole world. Now, many support these decisions and many are staunchly critiquing it. Now, one such controversial decision is the exit of US from WHO, that is World Health Organization.
What is this one?
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one.
Regrets the announcement that the United States of America intends to withdraw from the organization.
Now, this decision marks the second attempt of Donald Trump to get out and exit from WHO, whereby he has cited his dissatisfaction with WHO's management during the COVID-19 pandemic and during the COVID-19 crisis, and also the perceived political bias in WHO and disproportionate financial burdens on that of United States of America. Now, Donald Trump has announced withdrawal of US from WHO in 2020 as well during his first term. However, this was reversed after the election of Joe Biden as the president of US. However, now this new executive order reversing the decision taken by President Joe Biden and now again exiting US from WHO, it has sparked again the debates. It has also called into the question the role of US in global health diplomacy and its commitment to multilateralism in the entire world. Now, also alongside this, a debate on the role and functioning of WHO as an organization, its efficacy in managing global health pandemics, and also its role in investigating the origin of coronavirus. All of these things are again resurfacing, are in the center of debates. So now the real question is, why US has withdrawn from WHO? What will be the impact on WHO of this withdrawal, and what will be the impact on the whole global health pandemic situation and global health pandemic preparedness of the entire world, plus additional things which we as concerned citizens should be knowing about. All these things we'll be trying to understand in this particular session. Hello, my name is Preetpal Singh and all of you are watching Perspective. Now, firstly, let us understand why US has left WHO. And this we can understand from the statement published by the White House in relation to this matter. And they have clearly stated that the withdrawal of US from WHO is due to the organization's mishandling of the COVID-19 pandemic, which arose out of Wuhan in China. And also one more reason they have given, that is failure of WHO to reform adequately and to reform with the changing times. That was the second reason which is put forward. And the third reason which they have given is the inability of WHO to demonstrate independence from inappropriate political biases and political pressures from different countries on WHO. So that is the third reason which is why US is withdrawing. And additional to all these things, there's a fourth reason of a financial burden on US. See, US as a country with around 350 million population is contributing a lot more as compared to China with a population of 1.4 billion people. So they have stated that China with 1.4 billion population, which is 300% more than that of US, contributes nearly 90% lesser than US to WHO. So why US is disproportionately giving more and funding more to the WHO, this has raised a question. So why US is disproportionately giving more to WHO despite it not receiving that medical attention and the required outcomes which it ought to be? This is the question which Donald J. Trump has been asking since last many years. And this is also one of the reasons which has been stated in the White House press statement. So now all the reasons are in front of you. First one is mishandling COVID-19 pandemic. Second is not having adequate reforms, which is the need of the hour. Third is the perceived political bias and influence of China over WHO. And fourth is disproportionate financial burden on US by WHO. All these four reasons have been stated in the White House statement, which reflects why US has decided to withdraw its membership from WHO. Now, there have been some immediate actions which have been outlined in the executive order. The first action is to immediately halt any US funding to WHO. So there has been immediate cessation of all the financial transfers from US to WHO. That is first thing. Second thing is the withdrawal of personnel. So the recall of US government employees from WHO headquarters who are working with WHO. And third credible step which they are taking is development of alternatives. So development of alternative organizations which can help in the global pandemic preparedness, which can help in global health diplomacy and the healthcare of the entire global ecosystem. So developing certain alternate institutions as compared to WHO. Basically, to find domestic and international partners replacing the functions which are being fulfilled by WHO currently. And the last one is pandemic treaty exit. So discontinuation on the negotiations on WHO pandemic treaty. So discontinuation is put into effect as soon as this order was published. So all these four are the immediate executive actions to be taken by US after the publishing of this executive order. Now the real question is that since US has withdrawn from WHO, what will be the potential implications on WHO and the global health preparedness as well? See, first very important point is the financial strain on WHO. US normally contributes around 20% of the entire budget of WHO. So if US, they retract itself from WHO, the funding of WHO will be kind of choked. And WHO won't be able to fulfill its functions properly in the entire world if the funding is choked. So that is one very big problem and impact on WHO. Also, it would definitely impact the organization's ability to support healthcare programs, including vaccination development, education, eradication of diseases like polio, pandemic preparedness, all those other things. It will be devastatingly being impacted if US withdraws. And definitely US has withdrawn, so all these things are going to be taking place. So first point is clear, financial burden on WHO and financial strain on WHO is going to rise. Second point is the program disruption in the developing nations which WHO is continuing. So WHO is continuing several programs, health programs, eradication drives in different countries, developing nations, especially the regions of Africa, especially some regions of Asia and South America. In these regions, these activities will be severely impacted. So that is second thing. And third very major thing is the loss of US expertise. Now we all know that US is a technological hub and US is an advanced technological center. Now US personnel who are working in WHO, definitely they bring high tech to the table. And if US personnel are withdrawn from WHO, that high tech, advanced mechanization, advanced technology which WHO was enjoying earlier because of US, now WHO won't be able to enjoy. So that is the third problem area for WHO if US withdraws from it. But the question is that is WHO only going to be impacted or will there be an impact on US also? And definitely the answer is yes. US as a country will also be impacted, although not a lot, but will be impacted at least in short term. More in long term, several experts say that in long term, US will be facing a lot of consequences. But in short term, yes, there are certain negative consequences which US might see. And the first is in relation to limited access to global health data. Now WHO, let's question its efficacy, let's question about everything which WHO does. But still, the global health data, the coordination between countries, which WHO is supposed to do and is able to do, for that we need to commend WHO. And if US withdraws from WHO, the whole ecosystem, the healthcare ecosystem, world healthcare ecosystem developed by WHO as a network, US won't be a part of it. So US won't be able to take advantage of that healthcare network, which is why the burden of increasing cost of healthcare would be borne by US citizens. So first is limited access to global health data, and second is direct impact on the patients of US by increasing their costs. See also one more thing, that US could lose a lot of critical information on emerging infectious diseases in different developing nations which only WHO is privy to. See, because the workers of WHO, they are working on ground in many of these developing countries, especially African nations, and any infectious diseases coming into those countries, WHO, it informs US first, so that US can prepare its immigration plans accordingly and effectively. Now, if this data is lost or this connection is lost between WHO and US won't be able to tackle and restrict a lot of infectious diseases coming to their country from other developing nations. So that is one problem point which US might face. So first point is that this data and the help of WHO will be lost. Second is that the cost of the patient is going to increase. And third is in relation to vaccine preparedness. Now, to prepare any vaccine, any effective vaccine, definitely the infectious strain is required. And who possesses those infectious strains? WHO takes a sample of those infectious strains from different developing nations. Now, I'm not saying US can't do it, but for now, WHO is doing it for US and giving those samples to US so that they can treat those samples and make vaccines out of those samples. But if WHO's role is lost, WHO is not at all there in the picture, US has to do all those things entirely by themselves. So that can be one of the many potential negative consequences. And the most important of all will be the reduced influence in the global health diplomacy. Now for US, it might not be that strategically important because Donald Trump is clear with his Make America Great Again and America First policy. And he wants to focus on America first, American citizens first, and healthcare of American first as compared to the global health diplomacy. But still, US is a major power in the whole world. US is a developed nation and a superpower who basically influences decisions taken by a lot of developing nations in the entire world. So if US withdraws from WHO, the role of US in the global health diplomacy becomes questionable. But yes, US is looking for alternatives. So we must not forget that if US is able to find a credible alternative, US will again be back on the charts of the global health diplomacy. So that can be a potential negative consequence, but if US takes adequate measures, it might be avoided. Now let's take opinion of one expert, that is Dr. Ashish Jha. Now Dr. Ashish Jha is the Dean of School of Public Health in Brown University and also a former coordinator of COVID response team in White House. Now his views are an effective WHO is needed to keep the world safe from any health-related infections, health-related pandemics. He says that we need an effective WHO, not just to keep the world safe from infectious diseases, but also to keep Americans safe from these diseases. Also, one more expert, Tom Frieden, who is the former director of US CDC, he has also remarked that the bottom line is that the withdrawal of US from WHO makes Americans less safe than before. And he says not just Americans, but it makes the world less safe than before as well. Now, since all these things are clear, we need to understand what is WHO's stake in all of this and how does WHO perceive this withdrawal of US from its membership. See, WHO, responding to Donald Trump's order, has said that they regret United States' decision. And they say that we regret the decision taken by US and we hope that United States will reconsider, and we look forward, that is WHO look forwards to engaging in constructive dialogue to maintain the partnership between US and WHO. So WHO has also released a statement where they have mentioned that earlier in the last 7 decades, how WHO and US have coordinated perfectly, partnered perfectly in order to ensure that the world is a safer place to live. And this WHO would want to continue in future. That is why WHO has told US to reconsider its state and also to negotiate on the table and also to have a constructive dialogue to save and better the lives and the well-being of millions of people in the entire world. Now, in all this scenario, can we see any geopolitical shift, or can there be an increased role of emerging economies in WHO now? See, the withdrawal of US, it has paved the way and opened a window for the developing economies like Mexico, India, South Africa, China in order to get into global health diplomacy in a dominant way. See, China has already pledged $30 million more to WHO funding. That means they are taking the space of US in this multilateral organization. And experts, they suggest that this is an opportunity for India also to come to the forefront, pledge more funding to WHO and ensure that its foothold in the global health diplomacy becomes strong. See, India is very well known as the vaccine producer of the world, or very well known as the pharmacy of the world. But still, India as a leader in global health has a long way to go. See, India is currently positioning itself as the voice of the global south. But by focusing more on WHO, India can play a very pivotal role in shaping a balanced global health framework, which is for the betterment of all. And with this, the aspiration of India to become a global superpower in the near future, that might also be achieved, or we will be one step ahead in that. So now the question in your mind must be that if US has withdrawn, US has issued an executive statement and an executive order has been issued by the White House, and also WHO has given a counter response to it where they have told US to reconsider it. Now what happens next? See, it is not so simple, because in the WHO's agreement with US, the US has to provide 1 year's advance notice and pay any remaining balance to the organization in order to leave. So if US has to leave, they have to provide 1 year's advance notice and they have to clear out the balances which are remaining with the WHO. And one more thing is that this agreement between WHO and US, when it was created, it was done in 1948 when WHO was formed, and it was done through an act of US Congress. Now it's not clear that whether Congress would have to act to implement this withdrawal or not. So this is one sticking point where confusion is still there. Now there is Lawrence Gostin, who's a professor in Georgetown University, and he's also the director of O'Neill Institute. Now he says that this decision might open Donald Trump for a lot of legal challenges coming in future. Now Lawrence Gostin has written on X that Donald Trump's decision to pull out from WHO is a unilateral one. But for withdrawing effectively, he needs the ratification of US Congress, because the agreement between US and WHO has been made by an joint act of US Congress. So he says that Trump needs Congress approval before withdrawing. And he says that as a head of the Center for WHO, he is considering a lawsuit against Donald Trump. So that is one sticking point which we have already covered. And he also points out that the executive order, it calls for immediate cessation of any of the funds to WHO. But in that agreement of 1948, it is clearly mentioned that 1 year advance notice needs to be given and any due remaining amount which US owes to WHO needs to be paid first. So both of these things are not at all matching. And this is again a sticking point. Now let's see what experts have to say about this. Now, Dr. Michael Ostelholm from University of Minnesota has said that we as US have not experienced many infectious diseases outbreak in our country, and the main reason can be attributed to WHO. Because when any infectious disease is going to be spread in a developing nation, it is stopped then and there, and US is informed in advance. And oftentimes this is through the support and coordination by WHO. And funding the WHO is about investing in our own healthcare system, in US own healthcare system, rather than considering it as a payment which is extracted out of US disproportionately. This is what the views of experts are. But the question which many of you would be waiting for is that what would be its repercussions on India's healthcare sector? Or would there be any repercussion? See, one thing which we need to understand is that India is a very big recipient or one of the largest recipient of WHO support. Now, India could face indirect challenges due to this decision of US. Because if US chokes funding to WHO, withdraws from WHO is left with less funds. If WHO is left with less funds to the other developing nations, especially the developing nations which are a bit prosperous, WHO won't be giving that much money. So in case of India, now India is a developing economy but a lot prosperous than the other economies in Africa and South Asia and South America. So India would be given lesser funds as compared to before because of this funding being choked by US for WHO. Also, key programs like tuberculosis eradication, vaccine distribution, they can face delays and also reduced funding if the global health body's resources are stretched very, very thin. And also the absence of US support, it might drastically impact and negatively impact the coordination between Indian health agencies and WHO as well, potentially impacting a lot of initiatives to tackle the antimicrobial resistance, improving maternal child healthcare, which WHO is doing in India, and strengthening the healthcare systems of our country. But as we all know, that this step has been taken by Donald Trump in 2020 as well, where he called WHO as a China-centric organization, and he accused WHO that its malfunction or its functions has not been proper in understanding and investigating the origin of coronavirus. And while describing WHO as a China-centric organization, he also remarked that WHO has failed to alert the entire world about the threat of this virus, coronavirus. And in one of his statements, he has remarked that World Health Organization is China-centric. It has always been, and we are going to take a look at it. See, Donald Trump's comments on WHO, his decision to withdraw from WHO, his decision to withdraw from Paris Climate Agreement, and different other decisions taken by him, they are all in sync with his America First policy and Make America Great Again policy. Now, he has criticized not just one, but many other multilateral institutions as well. For example, WTO, for example, United Nations, and NATO also sometimes he has criticized that they lack the respect towards American interests. And disproportionate funding is being given by US to these organizations, which have been fueling these organizations since the last many decades. And in his last tenure, Trump has often argued that US has been unfairly treated in these organizations since very long time, and he has pushed for a lot of multilateral reforms in these multilateral institutions, and he has often sought renegotiation of the terms or outright withdrawal from that organization. So this withdrawal announcement, it is not new and it is not a shock, and it should not shock you, because the overall narrative or the overall policy statement which Donald Trump is carrying with him since the last 8 years, 9 years, this fits into this overall grand scheme of things. Now, since we have taken a look at this issue in a holistic way, very briefly let us try to understand what is WHO and what are its main functions. Now, WHO was formed in the year 1948 and it's a specialized United Nations agency. Now, it connects nations, partners and people to promote healthcare and to keep the world safe and secure. Now, some important objectives of WHO are first to lead the global efforts to expand universal health coverage. That is the first part. Second is focus on areas of disease prevention, control and elimination and the promotion of health and well-being amongst the people in the entire world. Third function is to provide leadership on the global healthcare issues and any such catastrophe or emergencies in relation to healthcare which arise in the world. So to provide global leadership in healthcare sector. And fourth one is to collaborate with various partners, various NGOs, governments, state governments, and different other stakeholders in order to ensure that the world is safe and secure with respect to healthcare. So all these functions are performed by WHO in different capacities. Sometimes they partner with NGOs, sometimes they partner with countries directly, sometimes they partner with the state governments, and sometimes they collaborate with different non-profit organizations as well. but the aim is one, to ensure global health universal coverage. Okay, one more interesting question. Has any other country withdrawn from WHO before? What is the answer? What do you think? The answer is yes. In 1949, 1 year after formation of WHO, Soviet Union and a lot of other satellite countries, they withdraw from WHO. But soon after that, in 1956, they were reinstated and they joined back. So that was one time where a lot of countries, they pulled back from WHO. Now there is one country, that is Liechtenstein. It is the only country which is a member of UN but not a member of WHO. And now after the withdrawal of US also won't be a member of WHO. See, one thing which we need to understand is that these decisions taken by US President Donald Trump, they are not to be outrightly criticized or not to be outrightly rejected, because there is some substance to this decision he has taken. There is some substance to the criticisms which he have already made as well. See, one thing is clear. WHO as an organization need to reform definitely. No questions about that. And Dr. Ashish Jha, which we discussed about earlier, he says that if we are going to give a grade, I would say that the reform efforts by WHO will get a straight C. And he says that while the agency's emergency preparedness and emergency response to outbreak, it has improved over the last many years, but still they have to deal with their underperforming personnel. And he also says that the culture of WHO is not fast enough, not flexible enough to tackle, or is not responsive enough for the fast moving and fast changing pathogens. Definitely these reforms needs to be there in WHO. So now question is, what is there for the future? See, one thing is clear. US through executive order has withdrawn from WHO. Now legally, is it standing still or not? Or do they need to pass an act in the Congress and withdrawal should take from the Congress? That is a legal issue where judicial clarity is required. That is one thing. Second thing is reformation of WHO. Until unless we reform WHO, nothing is going to change. And the third is strengthening collaboration amongst the emerging economies in the entire world. Now at the last, I would just conclude by saying that reform in a lot of multilateral institutions is not just need of the hour and is not just required by US, but is asked and required by India as well. Because see, this is 21st century. A century of artificial intelligence, a century of Industrial Revolution 4.0, a new century of robotics, machine learning, where everything is very advanced, high-tech. Aspirations of people have improved, living standards in the entire world have improved, per capita income of countries have improved. So WHO can't be a 7-decade-old organization. The steps taken by WHO in the past can't be the same in the future. WHO and other multilateral organizations, whether it be United Nations Security Council, whether it be World Trade Organization, whether it be all the organizations under UN or UN altogether, all these institutions, multilateral institutions, needs to be reformed. And needs to be reformed urgently, keeping in mind the changes happening, dynamic changes happening in the present society and the global world order. See, new generation requires new generation institutions. If you are not able to reform the institution, make them new generation, soon they will be becoming outdated and will be replaced by new ones. Which is why currently the need of the hour is reform through participation of all the stakeholders and dialogue. I hope you gained a new perspective from this session. Do let me know in the comment section what reforms you propose for WHO. I'll be very happy to read them. All the very best and have a beautiful day. Thank you.